I'm calling to order this hearing. This is a public hearing of the Committee of the Whole of the Council of the District of Columbia. I am Phil Mendelson, Chairman of the Council and Chair of the Committee of the Whole. Today is Wednesday, July 12th, 2023. The time is 9:19 in the morning. This hearing is being conducted largely virtually via the Zoom video conference broadcast platform. It's available as well, I believe, live on the Chairman's website, which is www.chairmanmendelson.com/live. Again, chairmanmendelson.com/live. And it's available on the council's website, which is www.dccouncil.gov. Again, www.dccouncil.gov. And the testimony will be available, I believe, as well on the council's website. Actually, I spoke too quickly. It might be available on the chairman's website. The subject of this morning's hearing is consideration of Bill 25-55 entitled Pathways to Behavioral Health Degrees Act of 2023. This legislation was introduced on January 20th of this year. I believe similar legislation was introduced in the last council period. The principal author was Councilmember Robert White, who's joined us, and I'll recognize in a moment in case he has an opening statement. Opening statements will be limited to 10 seconds. Just wanted to see if I could get a reaction there. Thank you, Councilmember. The stated purpose of this legislation is to support establishment by the university or at the University of the District of Columbia of a Master of Social Work degree program, and to establish a scholarship program for district residents and employees who are seeking higher education in behavioral health. There's a condition in return for the scholarship that the enrollees in the program have to commit to working for 2 years in the district for a nonprofit or the government or a school, public school, which could include a public charter school. The goal here, which is not the stated purpose in the long title of the legislation, is that we want to see more social workers in the district because we see a pressing need for social workers. We like social workers, and there aren't enough social workers. So working with our public university, this legislation would support increasing the number of social workers. The record in this matter will be open for 2 weeks. It will close at 5 p.m. on Wednesday, July 26th. Let me be clear, we are a political body. If somebody submits a comment to us in September, we'll consider it, but we have to file a record and we have a deadline for that. So if anyone wishes to submit comments and isn't doing so today, they have 2 weeks until 5 p.m. on Wednesday, July 26th to do so. I actually misspoke when I said that opening statements would be limited to 10 seconds. Councilmember White, you can take as long as you want or until I cut you off. Thank you.
Thank you, Mr. Chairman. I will take a medium amount of time, and I want to start by thanking you for holding this hearing, particularly after a long legislative meeting yesterday. I know it adds a lot of work. This is an important bill, so I appreciate it. I heard a story the other day about a kid who was being held at the DYRS service center because things got out of hand at home during an argument with his mother. She was scared both for him and for herself, so she called the police because she didn't know who else to call. The police arrested the kid, charged him with assault, and now he's in DYRS custody. Turns out there's a lot going on with this kid, and he needs quite a bit of support. I don't know all the details, but the staff at DYRS determined that he needs a bilingual therapist to help identify his challenges and work with him so that he can return to the community to be with his family, something his mother desperately wants. The problem is that finding an available therapist who is bilingual has been almost impossible. There just aren't enough. And now this kid will wait longer for services and maybe wait longer to get home. A few days ago, the Deputy Mayor for Health and Human Services and a few months ago, the Deputy Mayor for Health and Human Services and the National Park Service decided to close McPherson Square, leading to the removal of many people who set up tents in the park because they had nowhere else to go. During this process, the Department of Human Services and community-based organizations worked together to get people housed. But while most of these people were eligible to receive housing vouchers from the district, we couldn't get them into housing quickly because the district is experiencing a huge backlog in housing vouchers. This backlog is due to a lack of social workers who move people through the process. It means that some people at McPherson Square actually already had vouchers and were still living outside while waiting to be assigned to a social worker, while others got on the list to get a voucher only to be told that they would still have to wait for housing. People feel misled. They are told, we'll help you, and then weeks, months, years go by, and they're still living outside in a tent. Behavioral health specialists, like social workers and counselors, are part of our response to the challenges we're facing in the city, including homelessness, crime and violence, opioid and substance use disorder, and increases in mental health needs. That means the district agencies, community-based organizations, hospitals, and other healthcare providers that rely on social workers and counselors to provide therapy, do outreach to people experiencing homelessness, serve as addiction counselors, case managers, and first responders are all competing for the same employees. But the reality is we just don't have enough social workers to meet the demand. District government agencies and community-based organizations consistently report high staff vacancy rates that make it difficult to get behavioral health and caseworker support to residents who need it. These vacancies directly affect access to district services. As an example of the problem, the school-based behavioral health program alone has 105 vacancies. This program is meant to ensure there is at least one behavioral health clinician in each DCPS and charter school. Our students need the support, but many of them aren't getting it. And this is just one district program experiencing a 41% vacancy rate. To respond to this issue, to respond to homelessness, to respond to rising violence, to respond to the many residents I hear from who can't find a therapist, I introduced the Pathways to Behavioral Health Degrees Act of 2023 to ensure that the University of the District of Columbia has the funding it needs to create a Master of Social Work program and to make that program free for district residents and district employees who work for government agencies or healthcare providers. This bill will help build a pipeline of behavioral health specialists who can support our residents in times of crises and hopefully help them to avoid a crisis in the first place. Scholarship recipients will be asked to give back to the district by serving in a district school, agency, community-based organization, or healthcare provider for at least 2 years, ensuring that graduates of the program stay in DC, working to support DC residents. I'm very proud that we got this program funded in this year's budget so that whenever UDC is ready to begin, the funding is there for faculty and scholarship recipients. I want to thank my colleagues, Councilmember McDuffie, Bonds, Allen, Nadeau, Gray, Pinto, Lewis George, Fruman, and Parker for co-introducing this legislation. And I want to thank the entire council for helping me fund this important bill in the FY24 budget. I want to thank the public witnesses who are here to testify. Huge thanks to Dr. Potter and UDC for being here today. And thank you again, Chairman, for holding this hearing. I'm looking forward to the discussion.
Thank you, Councilmember White. With that, let me call the witnesses. I'm going to call, we have 22 witnesses, so I'm going to call 11 at a time. Jillian Burford, Jillian Hughes, Deborah Riggs, Neil Richardson, Mark Lavota, Salim Adolfo, Davinia Say, Pastor Michael Campbell, August Valentine, Manitra Martin, Alexis Robinson. Of the individuals I called, we have a new way of signing up for hearings. 2 are identified as Deborah Riggs as Executive Director of NASW, Metro DC Chapter, And Mark Lavoda is identified as Executive Director, District of Columbia Behavioral Health Association. I know that Salima Dofo is an ANC Commissioner. And I'm stalling for a moment to see that everybody I called is let in. If you are in the waiting room and I called your name, you need to accept in order to be elevated to the participant status for this Zoom. All right, let me see. Jillian Burford, I believe, is not here. Jillian Hughes, I see you. Why don't you begin? We have 4 minutes. The hearing notice said 4 minutes. And if you're in gallery view, you should see the clock. Remember to start the clock. Please proceed.
Thanks so much, Mr. Chairman. My name is Jillian Hughes. I'm a DC resident of 12 years, and this piece of legislation, if budgeted for and enacted, would directly benefit me and my future career aspirations, in addition to the many DC residents that I would serve. After working for 10 years in the DC media industry, I realized I had a deep passion for the mental health field. Since then, I've worked as an executive at a mental health nonprofit, a volunteer crisis counselor, and I've graduated from DBH's Certified Peer Specialist program. As some of you might know, peer specialists can provide behavioral health services in the district, but they are only paid at or slightly above DC's minimum wage. And I personally feel that if I want to provide behavioral health services in the district and still be able to afford my DC mortgage, that I need to obtain a master's in social work degree and a social work license. The options for obtaining this degree in the district are limited to private institutions, namely Catholic University and Howard University, whose costs are both about $1,000 per credit hour for a 60-hour degree. As a mid-career professional with a mortgage to pay, I do not feel that taking out loans to attend those programs is financially possible for me right now. And if I go out of state, it is possible that another MSW program may not meet DC's ultimate requirements for social work licensure. This bill addresses all of these issues, and I want to strongly encourage you all to get it passed. According to Mental Health America, DC ranks toward the bottom of the list, number 40 out of 51 for states with the most adults with a mental illness reporting an unmet need for mental health treatment. Almost a third of adults, 32% in DC with a mental illness, say they have unmet mental health needs. We can meet those needs with more workforce development, which is exactly what this bill aims to accomplish. I also want to address one argument that I have heard from a DC council member about not supporting this bill. I've heard the argument that because the BSW program, the bachelor's level program, enrollment numbers at UDC are quite small, that an MSW degree should not be offered or would not be well attended. I want to point out that, like myself, many of today's social workers actually take an interest in the field far after their undergraduate years. According to a 3-year survey of social work graduates released in 2020, 2/3 of respondents had an undergraduate degree in a field other than social work, and half of social work graduates had more than 3 years of outside work experience before they started pursuing an MSW program. That means that the average person looking to obtain an MSW is not someone going straight into a master's program after obtaining a bachelor's level degree. It's usually someone who, like me, wants to enter social work a bit later in life. I think you all will find that the level of enrollment in a bachelor's program is not at all indicative of the demand for a master's level program, and I am a prime example of that. Thank you all so much for your time today, and I hope that you will pass this piece of legislation.
Thank you, Ms. Hughes. Because there's so few witnesses, I'm going to ask you a quick question. Is $1,000 per credit hour for 60-hour degree, does that mean $60,000?
It does.
Thank you. Deborah Riggs. I can't hear you. If you're speaking, can you unmute yourself and start over?
My apologies. Thank you for giving me the opportunity to speak briefly to this piece of legislation. I believe that Ms. Hughes, I echo every remark she's made on behalf of NASW, Metro DC chapter. We represent over 1,000 social work members and many other social workers, constituents within the district, and we are in full support, 150% support of this bill. We know that workforce in the district, the workforce pipeline is in great need of getting folks through the degree as well as into jobs. And the association is poised to do whatever we need to help and partner with the city and with our private institutions to help further that pipeline and fill that pipeline. So I will just say thank you again. I hope that you will, pass this legislation. And I would like everyone to know that we are here if you need any information, support, and assistance, as this is a very important matter to all of us, as well as the clients that we serve. We want them to have access to services. Thank you.
Thank you, Ms. Riggs. Do you agree with the argument that Ms. Hughes put forward, that looking at bachelor program enrollment is not indicative of interest at the master level?
Yes, I do. I would agree with that, sir. I know that in my position, I talk to many prospective social workers who are in mid-career. It is not unusual, particularly in social work, that folks are coming from other for-profit industries and have a change of a change of philosophy, if you will. They want to do something and give back. They get tired of the quote corporate culture. And I have worked with many social workers in mid-career, like Miss Hughes herself, who do go back to get their master's degree in social work. So
Thank you.
Yeah, thank you.
I don't believe Neil Richardson is here. Mark Lavoda.
Mr. Chairman, there's a request from another panelist who has a time commitment. I wonder if you'd be willing to honor that.
What does that mean? I generally don't like moving folks around. What does that mean?
I saw in the Zoom chat that another panelist, August Valentine, is reporting a commitment that would mean a need to speak earlier.
All right,
I didn't know if you could accommodate that.
You can't wait 8 minutes? We're kind of just wasting time here. Why don't you proceed, Mr. Lavoda?
Okay, sure. Mr. Chairman and members of the council, thank you for the opportunity to testify today. My name is Mark Lavoda. I'm the executive director of the District of Columbia Behavioral Health Association and a Ward 2 homeowner. The District of Columbia Behavioral Health Association advances high-quality whole person care for district residents with mental illness or substance use disorders. Our 31 member organizations provide care to over 30,000 district residents annually, almost all who are Medicaid beneficiaries. In the midst of significant healthcare workforce shortages, we applaud the introduction of the Pathways to Behavioral Health Degrees Act and urge swift action by the council to bring this legislation into effect. On behalf of the district's behavioral health provider network, I want to affirm that the district needs both urgent action and long-term investments to meet the demand for graduate level trained behavioral health professionals. The introduced legislation is an important tool authorizing some of the needed long-term investments. I'll focus my testimony today on a few areas that the proposed legislation might helpfully be improved. The council should clarify the eligible degree programs covered by the legislation. The definitions in the subtitle could lead to inconsistent interpretation of eligible degree programs. Most specifically, the definition of accredited master's degree includes other master's degree programs accepted by the boards of professional counseling or social work. The definition is inconsistent with the list of eligible occupations considered as a behavioral health and human services occupation, which does not include a corresponding acknowledgement of other behavioral health occupations licensed under the Board of Professional Counseling and Board of Social Work. For example, the Board of Professional Counseling issues licenses to art therapists under a distinct art therapy license, while art therapy is not listed as a behavioral health and human services occupation. The council should eliminate the discrepancy. Given the small number of relevant degree programs and the small number of relevant other licenses currently administered by the Board of Professional Counseling and the Board of Social Work, adding the other relevant degrees and licenses would be helpful to support all possible qualified supplements to the district's behavioral health workforce. If meaningful additional costs from making other degrees and licenses eligible would mean that there would be a delay in implementing the legislation, the council should instead narrow the existing measure exclusively to professional counseling and social work degrees and licenses, most importantly, the graduate level licenses, and ensure that the legislation can go into effect as quickly as possible. The council should also clarify what types of organizations qualify as an eligible healthcare provider organization where individuals can meet the legislation's proposed work requirements. The council should recognize that the currently proposed definition does not provide a pathway for individuals to work in group behavioral health practices organized to serve district residents, but not subject to organization health licensing or certification. While many behavioral health settings, including outpatient practices, DBH mental health and substance use treatment providers, federally qualified health centers, and DBH freestanding clinics are licensed or certified as organization entities, there are no current requirements or pathways for group behavioral health practices to be licensed or certified under federal, state, or district law. Requiring individuals to work in licensed or certified organizations may inadvertently exclude individuals from working in other important settings, including group behavioral health practice organizations that provide significant volumes of outpatient behavioral health services to district Medicaid beneficiaries, including some CBOs in the School Behavioral Health Expansion Program. Minimally, the council should consider adding language that recognizes any organization that's enrolled as a DC Medicaid provider organization, which would include several group behavioral health practices that otherwise would not be qualifying organizations under the proposed legislation's definition of healthcare provider organizations. Thank you again for the opportunity to testify today and welcome any questions that you might have.
Thank you for your testimony, and your technical comments are helpful. Salima Dofo.
Good morning, everybody. Thank you, Chairman, for this opportunity. I would like to urge the Council of the District of Columbia to support the establishment of a no-cost Masters of Social Work degree pathway at the University of the District of Columbia, as well as a scholarship program for district residents, employees seeking higher education and behavioral health by passing and funding Bill 25-0055 Pathways to Behavioral Health Degrees Act of 2023. Mental health is affected by emotional, psychological, and social well-being. A person's thinking, feeling, and behavior are influenced by it. In addition, it helps to determine how one handles stress, relates to others, and makes healthy decisions. Every stage of life, from childhood to adolescence to adulthood, requires maintenance of mental health. A positive psychological and behavioral health can improve employees' productivity, their ability to cope with everyday stress, and their ability to maintain positive outlook and their ability to engage in healthy eating, sleeping, and exercise habits. Over the past few years, the National Institute of Health has funded significant behavioral and social science research that has made significant advances in the fight against disease and conditions that affect Americans throughout their lives. Studies in behavioral and social sciences help predict, prevent, and manage illness in individuals as in populations as a whole. Furthermore, this research assists individuals in changing their behavior, understanding treatments, and learning how to adhere to them. As it pertains to the residents of DC, children and adolescents exposed to violence may experience poor long-term behavioral and mental health outcomes, including depression, anxiety, post-traumatic stress disorder, regardless of whether they are victims, direct witnesses, or hear about the crime. In addition, research has shown as an association between exposure to violence as a child and an increased likelihood of experiencing intimate partner violence in adulthood. It is possible to reduce this violence among this population by increasing the number of mental health professionals that we have. As the first responder in an emergency situation, police are often called upon to deal with mental health crisis and substance abuse crisis. In spite of this, research indicates that police officers may lack the extensive training they need to effectively handle mental health crisis. Consequently, patients with mental illness and police officers may have a strained or even violent interaction. On the other hand, mental health professionals are trained to handle patients in crisis in an effective and non-punitive manner. It would be beneficial for healthcare professionals to take an active role in addressing mental health crisis in order to help reduce crime rate, as well as to provide better care to those living with mental illnesses. It is well established that mental health professionals are educated to provide acute care to patients, and their skill set could be used in conjunction with police to reduce non-serious crime rates as well. We can position our community to be successful in this area through the passage and funding of this bill. Moreover, by requiring program participants to commit to work in district LEAs, government agencies, or healthcare provider organizations for a minimum of 2 years, the District of Columbia is able to retain its best and brightest talent. This concludes my testimony. Thank you.
Thank you, Commissioner. Davinia Say, I believe, is not here. Pastor Michael Campbell, I believe, is not here. August Valentine, and thank you for your patience.
Of course, thank you, everybody. I'm sorry for the time constraint, but I come from the perspective as a recent UDC graduate of social work. I have my BSW in social work, and I also have the perspective of actually navigating the system as far as dealing with homelessness. Currently, I reside in a youth transitional home. I'm aging out, but as I navigated these services and also went to school and social work, I noticed that there also was a lack of social workers, which delayed my process and getting help while I was in school. I also did not get a lot of services in mental health. I was not able to get the therapy that I needed. I was put on multiple wait lists as I was navigating my degree. Because of that, I was not able to get certain diagnosis for my anxiety or treatment due to the wait list. I also now currently work with domestic violence survivors. And I also see that the importance of getting my master's, because I'm only able to help them in a limited way. And I believe another person spoke to this earlier. Basically, as I mentioned, I'm in a youth transitional home and I just started my job and I just graduated. I can't afford any of the masters in DC to attend Howard for 1 year. To even accommodate my schedule online is $70,000. As far as Catholic, you can go for free, but I would have to work for them for 2 years, but they would not be able to support my housing. Again, I am in transition to aging out. So again, I have to find a home, and that would not be sustainable for me and my lifestyle. It will put me in jeopardy of being homeless. Again, so I do think that this program is vital to our community, as well as many of my colleagues who attended the University of the District of Columbia who graduated with the BSW also look for master's programs. But again, they weren't able to afford it. So they have to plan ahead years later to even attain their degree in social work, their master's. And that also puts a delay again on the help that we can give to our communities as well as ourselves. So this program is not just beneficial to myself, it is beneficial to DC as well. Thank you.
Thank you, Ms. Valentine. Manitra Martin, I believe, is not here, and Alexis Robinson is not here. I have one question for Ms. Riggs. In your statement, you said NASW supports eliminating entry-level BSW and MSW exams and predicating competence on completion of a BSW or MSW degree from a CSWE accredited school of social work. Could you explain that?
Can you hear me?
Yes, I can't see
Okay.
you. I can't see you, but I can hear you. Oh, there you are.
Yes. So I apologize. I actually did write testimony and sent that testimony in regarding the exams and the issue with the exams with ASWB. I'm happy to go over that testimony. And it wasn't until really this morning that I realized right before I gave testimony that we were not speaking today about the exams and that issue. So I will push it back to you to tell me if you would like me to explain that in more detail, because I do believe that that's going to come up, and Mr. White might be able to also, if he can, Councilman White might be able to also add to that discussion. So would you like me to proceed?
Yeah, why don't you just explain what you meant by that? It's
So
not in the
basically,
legislation, and it probably
right.
won't be in the legislation, but please explain.
Right, so there is other legislation, I believe. Councilman White, you might want to, if you don't mind, help me here with that piece of it. There is legislation regarding removal of the entry-level exam
happy to
for
weigh
bachelor's
in,
level.
Ms.
I'm sorry.
I'm happy to weigh in quickly.
Okay, thank you.
Yeah. I appreciate you bringing this up. It is related in many ways in addressing the pipeline issue for social workers and people in the mental health fields. This is a bill that Ms. Riggs is referring to in the Health Committee, hoping to have a hearing in the fall on it. And what it does is responds to very high vacancy rates in the social work fields, but also a staggering disparity in passage rates for the social work exams. There are 4 levels of social work professionals. The 2 I don't want to call them lower levels, but more entry level positions still require hundreds of hours of training, require graduation from very strict programs, and require constant supervision from higher degree professionals. So we're trying to remove the degree requirement, which is only a few decades old for these 2 programs, and pull together a group that will help us develop a new licensing exams for the higher level of social workers. And I think we're going to have a very robust discussion on this bill in the fall.
So this is an issue on the licensing side.
On the exam side, I may have misspoken and said licensing, but exam, it's a change on the exam to become a licensed social worker.
Yeah.
So it is part of licensing, yes.
All right, that answers that question. Thank you. Councilmember White, do you have any questions for any of the witnesses?
Thank you, Chairman, and to all the witnesses. You actually jumped into what I was going to try to clarify during this part. And my only question, which you may know, Mr. Chairman, is whether we have Mark Lavota's testimony. I appreciated the technical feedback, and we really would love the opportunity to read through it a bit.
Yes, we did receive that.
Excellent.
And it's posted. Where is it posted? It's posted on the hearing management system. We have, for anybody who's interested here, we have a new hearing management system that is going to be implemented for all committees this fall. The committee of the whole is the guinea pig for this. And so all the signing up for this hearing and the submission of testimonies to the hearing management system, which is strange to me, but staff is learning, and apparently Councilmember White, you can get it there, Mr. Lavota's.
I appreciate it. My staff has letting me know that we have it, so I will read it myself, and
See, the staff is ahead of members.
Almost always. Thank you,
No,
Chairman.
not almost always. Don't say that. Don't admit that. Councilmember Nadeau, did you have any questions?
Well, first, let me note that the new hearing management system is pretty neat. I love it. you can just go to the page and click on whichever testimony you want while you're sitting in the hearing, which is kind of cool. So good job, Committee of the Whole. We look forward to implementing it as well. Thanks to this panel, I do not have questions. I wanted to just take a minute to note my gratitude to the chairman for convening the hearing and Councilmember Robert Way for introducing the legislation, which I co-introduced with him because, you know, we really are facing a behavioral health workforce shortage, and the need for these services has far outpaced the capacity of our existing workforce. I've done a lot of work in Ward 1 over the years to stand up programs and support the provision of behavioral health services for my constituents. But at the end of the day, we need these professionals to be trained and available to provide essential services. We need to have this multi-pronged approach to increasing the workforce and providing incentives and making it affordable to become a behavioral health professional, because it's really hard work. And there are many, many other jobs that one could get that are also rewarding and not as difficult. So it is a special person who takes this on, and we want to pave that road for them more easily. You know, so I'm very excited. And I appreciated the testimony, and I look forward to the rest. Thank you, Chairman.
Thank you, Councilmember. I have no other questions for you all. So you're excused from this. You can continue to watch the hearing as an attendee, and I'm going to call the remaining public witnesses. I'm actually going to start at the beginning, just in case anybody's arrived. Jillian Burford, Neil Richardson, Davinia Say, Pastor Michael Campbell, Manitra Martin, Alexis Robinson, Donis Garcia, Chandra Pickett, Christy Respris, who listed herself as President and CEO of Pathways to Housing DC, Constance Freeman, who listed herself as Survivor Membership Leader at Moms Demand Action, Will Doyle, Dr. Riabatu Bari, Sherry Daniels, Melissa Millar, I got distracted here, Aaron Carlisle Hall, and Shara Greer, who's listed as a public witness, but I know she's with Children's Law Center. All right, I don't see Manitra Martin. I don't see Alexis Robinson. I don't see Adonis Garcia. I'm actually told that Adonis Garcia is here, but needs to accept. There you are. So why don't we begin with you? Adonis Garcia.
Good morning. Can everybody hear me?
Morning. Yes.
Well, good morning. My name is Adonis Garcia, and I just graduated from University of the District of Columbia with my bachelor's in social work. And I'm currently interning at communities and schools at Cardozo High School. So a little background, I came to the US when I was 14 years old, and I didn't have any support, anything like that. I was raised by immigrants. My family didn't have much resources or even a way to work legally in this country back in the days. So I came to high school and I had a lack of a lot of resources, clothing, food, you name it. I needed it all. And then I came to Cardozo and I was introduced to a social worker that was able to help me to obtain all those resources and everything that I needed. I remember at first I didn't even want to attend college because I just thought that college was never gonna be for me. And my social worker was the first one to motivate me and tell me like, you should go to school, you should like seek for mental health stuff. And I can never forget that she was the one that actually helped me to choose my path to social work because of the amount of help and amount of resources that she was able to obtain for me and my family. So then when I got to college, she was the one that actually helped me to apply for scholarships. that actually helped me to apply to school and apply for everything that I needed. So now that I'm older, I want to do the same for all the kids that I'm working for. I'm currently working with a lot of newcomers, the Venezuelan newcomers, and a lot of the needs are almost the same as the ones that I had when I was here in Cardozo. And I just, like earlier, they were saying there's not a lot of help when it comes to bilingual communities and stuff like that. So that's one of my biggest issues right now too, because I want to help too many kids, but at the same time, it's like, too many kids coming to me because there's no one that speaks Spanish or that can help them with that issue. So that's why I decided to get my master's. But then after I checked the price of how much it would cost to obtain my master's in social work, there's no way I can do it. I am in inclusionary zoning too as well because of the same issue of housing in DC. So then I thought about getting my master's, but it's just impossible. They told me to even start would be like 70,000 an hour. So I couldn't make it, and it's really heartbreaking because I really want to work as a social worker, but there are certain things that I need, like the license and my master's, and there's like a huge need for social workers, and I feel that it should be provided for anybody that wants to help kids when it comes to mental health and stuff like that, because it's very important. And I am the result of what a social worker can do for you in your life. And, that's why I want to be that change in a lot of people's life and just help the new community, help my Hispanic community, and just be the best social worker. And I hope that this bill just go through and we can actually, get our degrees and start to help as many people as possible. Thank you.
Thank you, Mr. Garcia. I don't have a copy of your statement, so if you want one in the record, please provide it. Thank you. I don't believe Chandra Pickett is here. I don't believe Christy Respis is here. Constance Freeman, you would be next.
Good morning. Can you all hear me?
Yes.
Good morning. So my name is Constance Freeman. In addition to being the Survivors Membership Leader with Moms Demands Action DC chapter, I am also a second generation Washingtonian that was educated at Frank W. Ballou Senior High School and am currently pursuing a degree at Trinity University for clinical mental health counseling and trauma-informed and trauma-responsive training. The DC Moms Demands strongly support Pathways to Behavioral Health Degrees Act. It helps to increase the pool of qualified behavioral health professionals in DC who can provide much needed support in our schools, communities, and work to prevent violence. In addition to working to increase the pool of behavioral health professionals, this act represents a commitment to ensuring diversity, equity, inclusion, and access for the city's most vulnerable residents in crises with minimal to no resources, as we have heard a lot of other public witnesses testify to today. Presently, DC youth are in crisis with gun violence. The leading cause of death for DC children and teens, as well as children and teens nationally, is gun violence. A child is shot in the district more than twice a week, according to reports as of June 28th. 12 young people have been shot and killed this year, and more than 50 other children and teens have been shot and wounded. Not only are children being killed by guns at an alarming rate, but minors are also committing acts of gun violence. This is an enormous erosion of our children's social, mental, and emotional health that is undermining community stability, especially in the homes and communities of minorities. The youth in DC have been bombarded with many challenges since the start of COVID-19 pandemic and remain in crises, lacking the resources needed to support themselves and their health. Guiding our youth out of these crises is the responsibility of adults, institutions, and leaders around them. The Pathways to Behavioral Health Act degrees is a tangible commitment towards healing and the action of comprehensive solidarity in addressing college affordability, an urgent need for more behavioral health professionals, and a humane response that offers the support and resources that our communities need to thrive. The initiative aligns with the "what happened to you" model instead of "what is wrong with you," modeling a trauma-informed responsive approach that is critical in offering sustainable health practices to youth, families, and communities. Behavioral health professionals are critical advocates who help young people develop coping skills and deal with trauma in a healthy way, especially as they see many of their peers become victims of gun violence. We strongly urge that the district invest in this type of holistic approach to prevent gun violence, which takes into account the immeasurable financial, social, and emotional impact caused by gun trauma to DC residents and their families, and directs resources where they are most needed to give our young people the tools they need to thrive instead of resorting to violence. Each homicide, the district takes another one of our friends, loved ones, or neighbors who should still be with us. We must prioritize and invest in proactive violence prevention as a core part of our work. I'm about to go over. Is it okay if I finish my testimony?
Actually, no, I appreciate you recognize that, but no, everybody's limited to a 4-minute clock. So
Okay,
I do have your written statement. So thank you. I'm going to turn now to Will Doyle if he's here, but I don't think he's here.
Yes, I'm here. Can you hear me?
Yes, I can.
Great. Thank you. I did put something in the chat because I know Christy Respich is also here, but she wasn't promoted to be a panelist. But I'll go ahead. Good morning, Chairman Mendelson and council members. My name is Will Doyle, LICSW, and I'm the Director of Housing Operations at Pathways to Housing DC. Our mission is to end homelessness and support recovery for people with complex health challenges using the Housing First model that we brought to the district in 2004. Thank you for your commitment to DC residents, as evidenced by reintroducing this important bill and prioritizing funding it in FY24 budget. I appreciate the inclusion of funding for both Masters in Social Work and Masters in Counseling degrees. As a result of the shortage of social workers, I've had the privilege of working closely with 3 amazing LPCs at Pathways to Housing. All 3 have served as clinical supervisors of our permanent supportive housing program, with one currently the clinical director of our mental health programs. Their work with our permanent supportive housing program has brought our client services and staff supervision to the highest levels as a provider since 2008. DHS recently added LGPC as an option for permanent supportive housing program case manager supervisors, with LGSW, LICSW, and LPC already being options. As a result, all those who benefit from this bill will have the opportunity to support the growth of this program to fully utilize funding housing vouchers and ending homelessness for our most vulnerable neighbors. In my work as the program manager of our permanent supportive housing program since 2008, I have supervised many staff and interviewed many potential staff. I have witnessed that staff connection to the community they work in and innate understanding of challenges their clients face both positively impact the quality of services they provide. These are also qualities that differentiate individuals who have master's degrees. I firmly believe these qualities will be present in those who benefit from this bill as DC residents and either graduates of DC public schools or employed by DC agencies. This bill also removes barriers for people who have the passion and potential to do great things that significantly benefit DC residents, but who otherwise may not have the opportunity to gain the crucial skills and knowledge provided by a master's in counseling or social work. In this way, it will be incredibly impactful. While the cost of tuition alone for master's degrees can be a prohibitive barrier, the additional costs of books, supplies, living expenses, transportation, and license fees significantly add to that burden. This bill comprehensively addresses all these essential needs so students can focus their energy on their learning and graduate with the maximum level of knowledge and skills. They graduate without the burden of student loans, greatly benefiting them as they navigate the often challenging early years of their career and the related licensing exams required to work in DC. I am asking you support this bill as introduced. Thank you.
Thank you, Mr. Doyle. If Christy Respis is here, she needs to accept in order to be promoted. And I'll call her if she does. Next would be Sherry Daniels.
Hi. Oh, sorry.
Oh, you're there.
I'm in the same office as Mr. Doyle, and so I just came down to his computer. It doesn't seem to be, the link is not opening for me. Is that okay? Should I wait?
No, go ahead. Go ahead, and then I'll hear from Ms. Daniels.
Great. And I'll be brief. I think we've got so many great people testifying. So again, thank you, council members and Chairman Mendelson. My name is Christy Respres. I'm the president and CEO of Pathways to Housing DC. Each year, Pathways helps prevent and end homelessness for over 3,500 people in DC and Maryland. We provide behavioral health, supportive housing, and street outreach services with a staff of about 145 people. This bill is critical for a number of reasons. We're really thrilled by this introduction. First, it creates pathways for district residents to earn degrees that significantly increases their economic mobility. Research clearly shows that having a higher degree in fields such as social work, where there's high job demand, leads to substantially higher wages and lower unemployment. While many district residents would love to earn their master's degree and commit to working in their community, the exorbitant cost of graduate school, as you've heard, and all the related expenses is out of reach for many without incurring significant debt. This legislation will remove that barrier and lead to greater economic mobility and prosperity for these students and their families. Secondly, there's a serious shortage that you've heard about, and you know that's the point of this, of qualified behavioral health professionals in the city and around the country. That shortage is even greater when we consider the types of job settings the behavioral health staff typically want to work in upon a graduation. The majority of students graduating with master's degrees are not working in the community and in people's homes in programs like assertive community treatment or permanent supportive housing. Organizations like Pathways knows that when we get wonderful master's level interns working in behavioral health settings like ours, people are more likely to consider continuing that work after graduation. And thirdly, we want district residents working with district residents. I'm grateful for every social worker, counselor, peer, psychiatrist, nurse, and other staff member who chooses this very sacred work. I also want to say thank you to all of them. Additionally, I want to say thank you to the people who are from this community. I have witnessed many, many times in my 18 years at Pathways, the impact of someone from this community, from the district, working with the people we serve. As an organization and a city, we must continue our commitment to recruit, retain, and support a diverse workforce representative of the people we serve. This legislation is a critical investment in this commitment. Thank you so much for the time.
Thank you, Ms. Respis. I don't have a copy of your statement. If you could submit that, please.
Yes, it's been submitted. Yep. Thank you.
Thank you. Sherry Daniels, and thank you for waiting.
Okay, thank you. Honorable Chairman Mendelson and members of the Committee of the Whole, greetings. My name is Sherry Daniels. I am a proud resident of Ward 8 with a master's degree in psychology, a community caseworker, and a prominent civic leader for education reform now in DC. As someone who works at the forefront of providing mental health services to DC residents, I'm here today to wholeheartedly support the establishment of a Master's of Social Work degree program at the University of the District of Columbia. I was pleased to testify in support of this legislation in April, and I'd like to expand upon the previous testimony of Minitri Martin and delve deeper into the specifics of implementing the solutions discussed. Manitri's testimony accurately drew attention to the urgent mental health needs of our DC youth, especially in marginalized communities, and I am intimately familiar with this issue through my daily work as a community behavioral health caseworker. The establishment of a Master of Social Work degree program at the University of the District of Columbia, as proposed in this bill, offers a direct response to these needs. However, the successful implementation and impact of this program will depend heavily on the strategic decisions we make now. To expand on the essential aspects Minitri touched upon, I offer the following specific recommendations. First, to collaborate with entities such as the National Institute of Mental Health and the American Psychological Association. Minitri suggested the importance of aligning with distinguished institutions such as the National Institute of Mental Health, as well as local hospitals and organizations. To amplify the program's reputation and facilitate enriched learning experiences, the program could develop a Learning Partners initiative where each semester a group of students is paired with the partner organization for research programs or practicum experience. This model not only provides students with unique learning opportunities, but also helps institutions gain fresh perspectives from the upcoming generation of social workers. Secondly, partner with philanthropic organizations and foundations in DC to establish scholarships, sponsorships, or internships. Through the scholarship program, UDC could support practical training opportunities. Internships or fieldwork experiences are essential components in the education of social workers, and financial support for these experiences would significantly aid students. Additionally, UDC could leverage technology and innovation in its teaching methodologies. In this digital age, there are myriad text-based tools that can revolutionize the teaching of social work. For instance, incorporating simulation software and artificial intelligence programs can offer students the opportunity to practice skills in a risk-free environment before working with actual clients, and can make the program more future-ready. Thirdly, implement a DC-centered curriculum to address the unique challenges. The program should engage with local community health centers, schools, and the Department of Behavioral Health to develop a comprehensive understanding of our community's unique needs. By introducing courses or specializations that focus on DC's specific demographic needs, we can ensure our graduates are well equipped to serve their community effectively. And then lastly, develop and execute a comprehensive public awareness campaign to ensure potential beneficiaries are informed about this program. So develop and execute a comprehensive public awareness campaign to market this program to local educational agencies, so counselors are aware and can work to intentionally build our career pathways in these fields. This Master of Social Work degree program is more than a course of study. It is a commitment to the future well-being of the District of Columbia. By investing in the program and its graduates, we're investing in our community and shared future. Thank you for your time, and I hope you will give due consideration to our proposals and the potential they have to enrich our district's education landscape and uplift our community.
Thank you, Ms. Daniels. I believe Dr. Ribatu Bari is not here. Melissa Millar, you would be next.
Good morning, Chairperson Mendelson and members and staff of the Committee of the Whole. Thanks for the opportunity to testify today on Bill 25-55, the Pathways to Behavioral Health Degrees Act of 2023. I'm Melissa Millar, Policy Director for ZEDIC DC. Headquartered at UDC, ZEDIC DC's mission is to safeguard the legal rights and financial health of DC residents with low incomes dealing with the often devastating consequences of abusive debt collection practices and other consumer-related issues. We carry out our mission with the goal of addressing racial gaps in wealth and equity and offer direct legal and financial counseling services at no cost to DC residents within 400% of federal poverty guidelines. This bill would support the University of the District of Columbia in establishing a Master of Social Work degree pathway and establish a scholarship program for district residents and employees who are seeking to higher education in behavioral health. We support expanding opportunities for social workers and behavioral health providers in the district. There is consistent need for social workers and their services, whether to assist persons experiencing homelessness move into housing, assist a new mother attain benefits, or attend to a crisis mental health response call. Creating an accredited master's degree program at UDC, accepted by the district's Board of Social Work and Professional Counseling, will help increase the availability of district-based providers and potentially the pool of professionals with lived experience that may be mirrored by residents seeking services in the community. Further, this bill seeks to establish a behavioral health and human services scholarship program to provide financial services assistance to individuals who have bachelor's degrees and seek to obtain an accredited master's degree and become licensed in behavioral health or human services occupation to work in district local education agencies, government agencies, or healthcare provider organizations. The proposed financial assistance would include tuition at UDC, academic costs, such as the cost of books and supplies, and a monthly stipend for living expenses and transportation. The bill also contemplates covering fees associated with obtaining a license. We greatly support the scholarship program, particularly as it would provide additional funding for monthly support stipend for living and travel expenses. Many current and former students are crushed by their student loan debts, Creating a program to support the education of new providers without saddling them with potentially tens of thousands of dollars in educational debt is a thoughtful way to address both the professional needs of the district as well as the personal needs of those providing the much needed services the district and its residents require. However, we do note a lingering issue. At Zedek DC, we have been seeking to reform the Clean Hands Law as it applies to people seeking to access work and business opportunities. For example, each of the district's health professional boards have different application and documentation processes, but by law, DC Code Section 472862 prohibits the issuance of any license or permit by the district government if the applicant, among other things, owes the district more than $100 in past due taxes or more than $100 in outstanding fines, penalties, or interest. This application of the district's Clean Hands Law to health occupational licensing specifically prevents people with debt of over $100 from being able to practice in the district. In recent weeks, the district has stopped applying Clean Hands to the obtaining and renewal of driver's license, a change that will have a positive impact on Zedek DC's clients and tens of thousands of other district residents. Yet Zedek DC has other clients who continue to be prevented from becoming licensed in the district in occupations, including health occupations, due solely to debts owed to district government. So we recommend that the committee consider revising the Clean Hands Law, or DC Code Sections 472862 et sec, to prevent the disqualification experienced by our clients and likely countless other qualified district residents. The district is the only jurisdiction in the greater DC region to automatically disqualify individuals from obtaining occupational and small business licenses due to small unpaid debts like unpaid parking and traffic-related debt. And as a result, our resident practitioners are providing services to Marylanders and Virginians and not district residents. We support the bill before the committee today, but fear the existing DC law could yet prevent graduates from this well-intentioned program from becoming licensed if they owe more than $100 to the district government. In addition to the proposals being discussed in this bill, we believe that eliminating the Clean Hands prohibition on licensing our health professionals is also key to supporting district residents' health and district providers' financial security. Thanks for the opportunity.
Thank you, Ms. Millar. I don't have a copy of your statement. If you could provide that, please.
I did submit it, yes.
Thank you. I see that Dr. Bari has arrived. Do you want to proceed?
Hello, good morning. Chairperson Phil Mendelson and Committee of the Whole members. I am Dr. Rabiatu Berry, excuse me, a licensed clinical psychologist, assistant professor at the University of Maryland, and a civic leader for Education Reform Now DC. Thank you for the opportunity to testify before you today. While I am a Maryland resident, I do have the privilege of training and collaborating with numerous students and professionals who serve DC residents. I see the impacts of policies in DC extend beyond its boundaries, significantly affecting the broader region, including Maryland. In March, I testified in support of this legislation and urged the Committee of the Whole to hold a hearing on the bill. Thank you for listening. Today, I will present actionable steps to enhance mental health services in DC public schools, supporting the overall well-being and success of our students. Building on the testimonies of my fellow education reform champions, Manitri Martin and Sherry Daniels, I would like to propose that UDC consider the following enhancements in implementing this program. Consider broadening the eligibility requirements of the program. So while the current criteria aim to ensure program benefits the district, we must not forget about individuals who might not have attended DC public schools, but have strong ties to the district or clear intent to serve our community in the future. For example, people who may have relocated to the district after high school education, but have been contributing to the community for a significant time, or anyone who has completed relevant associate degree programs, earned certificates in the district, and intend to pursue a career in behavioral health in the district could also be strong candidates for this program. Also, we would like to ask you to provide mental health services for program participants. So the emotionally demanding nature of behavioral health work makes this proactive measure crucial for ensuring the well-being of our future professionals. As a current professional in this field, I can attest to the importance of this service for trainees and professionals. Also, establish a clear framework for oversight of program effectiveness. So to ensure the efficacy and accountability of these measures, I recommend that UDC establish a clear evaluation framework for these initiatives. Regular monitoring, tracking of graduates' career progression, quality of education, and participant feedback will ensure the program meets its intended goals. Key performance indicators could include clinician retention rates, student graduation rates, and post-graduation employment in the district's behavioral health services. In conclusion, by implementing these measures, UDC will send a strong message about its commitment to its long-term strategy and preparing our own local students for the careers that our community most needs. The proposed solutions backed by the DC Council's unwavering commitment can lead to profound and lasting positive impact on the lives of countless children and adolescents in the District of Columbia. Thank you for your time and consideration. I look forward to the opportunity to answer any questions that you may have and to further discuss this legislation. Thank you for my time.
Thank you, Dr. Burry. I don't have a copy of your statement. If you could provide that.
It was submitted yesterday.
Thank you. Aaron Hall.
Hello, hi.
Good morning.
Good morning. Can you hear me?
Yes.
Excellent. Good morning, Chairperson Mendelson and other members of the council. My name is Erin Hall, and I'm a trauma surgeon at MedStar Washington Hospital Center and the medical director of the MedStar Washington Hospital Center Community Violence Prevention Program. I'm testifying today on behalf of the MedStar Washington Hospital Center in support of this bill that aims to help build DC's pipeline for behavioral health specialists. MedStar Washington Hospital Center's Community Violence Intervention Program provides wraparound services for survivors of gun violence and other violent injuries. Our services include patient advocacy, treatment navigation, mental health crisis intervention and referrals, connections to emergency safe housing, long-term affordable housing, support with public benefits and civil legal needs, and financial and transportation resources. We seek to interrupt the cycle of violence in our community with two main goals: prevent re-injury for those who experience gun violence and prevent retaliatory violence. While our team is blessed to have a licensed clinical social worker on staff to help provide crisis intervention and mental health counseling for short-term challenges, more workforce resources are needed to break generational cycles and support our community's overall well-being. One of the most consistently identified needs of our participants is for culturally competent, long-term mental health support. Many of the patients we serve struggle with taking care of their mental health even before experiencing the life-changing effects of gun violence. They experience daily stress from structural racism, food insecurity, violence, and crime in their community, and more. Research shows that adults with mental illnesses experience violence at high rates and are more likely to be victims than perpetrators of community violence. Through our work with victims of violence, one of the biggest challenges is that when we finally get people to a place of being ready to accept help with their mental health, there are no resources available for two reasons. One, mental health care is incredibly difficult to find in our nation's capital, even for the most well-resourced individuals. The DC Health Matters Collaborative estimates that 60% of adults and youth with mental illnesses are not receiving treatment. This challenge is multiplied when you layer in additional challenges of trying to identify providers in DC who accept Medicaid, with only a handful of organizations and practices available who are incredibly understaffed and with limited resources. There also remains a significant stigma around mental health care and distrust of medical providers. To build trust, it is important that providers have the right practice experience to support our community's needs. Ideally, that means they are from DC and have lived experiences with the challenges our patient population faces day in and day out. This bill would be a first productive step to providing supportive resources to the district's residents who are looking to take care of their mental health. It would offer residents the opportunity to make a difference in their communities while building a new career path and develop our DC-based healthcare workforce. I thank you for the council's time, and I'm happy to accept any questions.
Thank you, Ms. Hall. Thank you for your testimony. I don't have a copy of your statement either, if you could provide them.
I uploaded it just this morning, so it might be a little bit of a delay in that way.
Okay. Next is Shara Greer, who's listed as a public witness, but I believe is with Children's Law Center.
Yes, good morning, Chairperson Mendelson and members of the council. I am Shara Greer, and I am the policy director at the Children's Law Center and a resident of the district. I'm testifying today on behalf of the Children's Law Center. Our more than 100 staff work with DC children and families, community partners, and pro bono attorneys towards a future where every child can grow up with a strong foundation of family, health, and education and live in a world free from poverty, trauma, racism, and other forms of oppression. I appreciate the opportunity to testify in support of the Pathways to Behavioral Health Degrees Act of 2023, which supports the University of the District of Columbia to establish a Master's of Social Work degree pathway and a scholarship program for district residents and employees who are seeking higher education in behavioral health. This has been said all morning. There's a critical need for workforce development in behavioral health care, particularly with children and adolescents. There's a crisis. The mental health of children and adolescents is trending in dangerous directions. And this is a trend that is not just remnants of the COVID-19 pandemic, which certainly made things worse, but mental health symptoms, including depressive symptoms and suicidal ideation, have been steadily increasing among American youth for over a decade. In 2018, suicide was the second leading cause of death for young Americans 10 to 24. Nearly 15% of DC high school students reported attempting suicide in 2019. That's 5% more than the national average. We know that early intervention, from screening to treatment, can change the lives of children and adolescents and help improve the health of families and communities. However, only 1/5 of children with mental, emotional, behavioral disorders ever receive care from a specialized provider. For this unmet need for behavioral health services is worse for children of color. The District of Columbia has recognized this crisis and has made strategic investments in many ways to increase access to care. For example, the school-based behavioral health program, which is Councilmember White mentioned at the beginning of his remarks, envisions having a licensed clinical social worker embedded in every public school in DC. Unfortunately, that program and many other programs across the city, as has been mentioned by other witnesses, are struggling to recruit and retain qualified clinical social workers. These staffing challenges are driven by the shortage in healthcare professionals that is not just in DC, but is also across the country, but is a crisis in DC. And we see our clients often having long waits for treatment if they can actually get the specialized services that they need. And that's with a lawyer helping them navigate a complicated system. We need more practitioners, and the Pathways to Behavioral Health Degrees Act of 2023 will help us build an adequate workforce. This legislation creates an accredited master's degree program that sets us on the right track to our ultimate destination, an adequate, resilient workforce to meet the district's needs. It will help people already connected to DC get their degree and keep them working in DC for at least 2 years. Because our healthcare system doesn't need just more professionals, we also need providers in the field who district residents can have rapport and trust with. Many minority youth prefer behavioral health providers they can relate to. Providers who have similar backgrounds to the youth receiving care are more likely to form a strong therapeutic bond and achieve better outcomes as a result. Youth also need providers that speak their native language. This is why the Act's requirement for a connection to DC to participate in the scholarship program is vital, and we support all efforts to recruit community members into the professional pipeline across the city. We need these new professionals to help fill our current gaps and urge that UDC establish specialized training within the program related to the behavioral health needs, which are currently underserved locally. And this includes children and adolescents. We thank the council for including funding for UDC to begin this much needed program in its fiscal year 2020 budget and urge this bill move quickly into law. My written testimony contains more details and suggestions for actions to ensure that the health system these professionals enter is supportive and sustainable. Thank you for the opportunity to testify, and I look forward to any questions.
Thank you, Ms. Greer. And I do have a copy of your statement, so thank you for that. I don't have questions for any of you. Let me turn to my colleagues. Councilmember Robert White, do you have any questions?
I do, Chairman. Thank you. Well, more comments than questions. I want to thank the witnesses for being with us today. Adonis, who testified, I think, first on this panel, had an incredible personal story, also highlighted the great need for more mental health professionals, but also why it is difficult for many people to get into this field and why it's not just a program, but a scholarship is necessary. So I want to thank him for his testimony. Ms. Respris mentioned something that I think is particularly important, which is having people working for our agencies and organizations who come from the communities. And, you know, when we do that, we have these organizations and agencies learning, I think, as much from people with lived experience as those folks are learning, something that Melissa and I think Dr. Barry or Dr. Hall mentioned as well in their testimony. So I do appreciate that perspective. I think it's a very important one. For Sherry, really good recommendations on some things I think UDC should be considering, along with Dr. Barry, who spoke about tracking key performance indicators. I think that these are some important things for UDC to look at: partnerships, internships, collaborations, how we gauge the performance of this program so that it's not just up and running, but it becomes a major pipeline for the District of Columbia and its residents, and it's improving as it goes. So I really appreciate those notes. And I also agree with Sherry Daniels that a public awareness program would really help. The more residents know about this opportunity, the more successful it will be in so many ways. And finally, I just wanted to note Dr. Hall's testimony. I thought was very powerful from the perspective of someone who deals often with victims, some of the victims of violence, particularly gun violence, but also the discussion in Dr. Hall's testimony about how this bill and this program relates to mental health more generally and the stigma. So a lot of really powerful things in these testimonies. Ms. Greer, I'd stopped taking notes, but one part of your testimony really caught my attention that I think is important, which is as UDC develops and runs this program, for it to pay particular attention to where the gaps are, where the specific gaps are, so that they can be better at filling those gaps. There was a lot of other great stuff in these testimonies, but I just wanted to highlight a few things that I think came out really well, and just wanted to take an opportunity to re-highlight them. So I will be reviewing the submitted testimonies in more detail to make sure I'm not missing things, but I do want to thank you all for bringing your perspectives and expertise to this hearing today. Thank you, Chairman.
Thank you, Councilmember White. Councilmember Nadeau, do you have any questions?
Nope, thank you.
Councilmember Parker, we've been joined by Zachary Parker.
Questions, but I do thank everyone for their testimony.
Well, I thank you all as well. And some of you, I asked for copies of your statements and they've been submitted. We've got this new hearing management system, so I'll get them shortly. Thank you all. You all are excused. I'm going to turn now to Dr. Lawrence Potter from the university. Dr. Potter, when you're ready, why don't you proceed? And good morning.
Good morning. Can you hear me, Chairman?
Yes, I can.
Good morning to Chairman Mendelson, members of the Committee of the Whole, and staff. I am Dr. Lawrence T. Potter Jr., and I serve currently as the Chief Academic Officer at the University of the District of Columbia, our nation's only urban land-grant institution and the public university of choice in, of, and for the District of Columbia. I am pleased to testify on behalf of the university and the creation of a new accredited Master of Social Work program that is uniquely designed to educate and train the next generation of social work and behavioral health practitioners to serve the residents of the District of Columbia, the region, nation, and beyond. Our last Bachelor of Social Work accreditation visit by the Council on Social Work Education was in October of 2021, and our program is now accredited through 2029. With the completion of the Bachelor of Social Work accreditation, UDC turned its attention to developing a Master of Social Work curriculum in spring of 22. The initial steps included consultation from our Social Work Advisory Board, which focused on the practice needs of the DMV and the profession. The MSW program builds upon the mission and goals of the BSW program and prepares generalist social workers to address priority issues of the district by increasing the behavioral health workforce. Expanding graduate offerings to meet these local needs is a priority of the university. Attention has been given to the focus and structure of the program. UDC's MSW program will be an advanced generalist practice with specializations in areas such as behavioral health, environmental justice, healthcare, and community organizing. These specializations consider the grand challenges of the discipline and the profession, DC areas of focus identified by the mayor's office, and specializations that differ from local MSW programs in the DMV. In compliance with the Committee on Social Work Education candidacy application, consideration must be given to the specialized areas of local accredited MSW programs and clearly distinguish between what is already offered and what the proposed program will offer. An initial review indicates accredited MSW programs in the DMV that serve similar student populations as UDC have two program tracks, a direct clinical practice and a macro practice. Our advanced generalist practice focused MSW would not only distinguish UDC from the other local universities, but will also help equip practitioners with advanced knowledge and skills in the integration of research, theoretical modalities, and ethical and cultural responsiveness in multi-method approaches in engaging, assessing, and intervening at all levels with a social justice focus. In alliance with the program's current focus, particular attention would be given to issues of contemporary urban living. The social work program draws on the university's mission to produce lifelong learners who are transformative leaders in addressing complex societal issues, collaborating with diverse client systems, and empowering multi-level systems to eradicate local, national, and global social justice issues. The UDC MSW program will be an option for students interested in pursuing an advanced generalist degree at the only public university in the District of Columbia. The MSW program aims to prepare advanced credential practitioners to critically examine complex, real-world problems and intervene with evidence-based, culturally responsive, trauma and climate-informed approaches. Field education is the signature pedagogy for social work. Thus, the MSW program aligns with the university's plans for students to apply learning outside the classroom by enriching the curriculum with experiential learning. The social work program aims to empower its graduates to be self-reflective, critical thinkers who demonstrate integrity and process the leadership skills to foster positive, transformative change in their profession and communities. In summary, UDC's MSW program is designed to implement a strengths-based educational experience aimed at 1, developing competent ethical social work practitioners, 2, fostering the development of social work research and providing social work consultation, training, and other services to professional community groups and organizations, and 3, modeling and embedding anti-racist diversity, equity, and inclusion practices throughout the curriculum in working to dismantle oppression, discrimination, and poverty systems. On behalf of my colleagues at the University of the District of Columbia, and in honor of Professors Janet Burton and Angela Bullock, who have passed on, I want to thank you again for the support and the opportunity to testify. I am happy to take any questions you or your committee members may have.
Thank you, Dr. Potter. I do have some questions. Let's try a 10-minute clock. First, in your statement, I had a couple of questions. One, I did not understand this sentence on page 2. In compliance with the CSWE candidacy application, consideration must be given to the specialized areas of local accredited MSW programs and clearly distinguish between what is already offered and what the proposed program will offer. Can you explain that?
Absolutely. So the Council on Social Work Education does not like duplicative programs. If they are going to come into the district and accredit a new program, it must be a program that is distinctively different from the other 3 accredited programs here in the district. So the programs at Catholic University, Gallaudet, and Howard University all offer a unique kind of perspective in the training and development of their social work students.
Each of them is different from each other?
Very different.
Keep going.
And so the university is proposing in our candidacy application a very different approach that focuses on behavioral health, mental health, and all of the things that we outline here in the state.
So there was a witness who testified that at one of the private institutions, that it's roughly $60,000 to get a graduate degree, postgraduate degree. So let's just say Catholic has got the best social work program in the world. Nobody else can duplicate it here in the district?
No, if they want accreditation from the Council on Social Work Education.
So I don't like quite the emphasis in your program, but I love the emphasis in the other schools' programs, so I have to pay $60,000.
Essentially.
So the way ours will be different is that it doesn't focus as much on direct clinical practice or macro practice, but instead is a more, I'm trying to find the words here, generalized.
It's an advanced generalist practice that will deal with issues surrounding behavioral health. It will deal with developing ethical, competent social workers. The focus will be on anti-racist, dismantling systems of racism, equity systems, poverty systems. But more importantly, the theoretical models will be really built around a cultural responsiveness approach in multi-level and multi-methods of how we deal and solve problems in an urban context. And none of the other programs are very specific. And so these are the types of issues that we have outlined in our candidacy application with CSWE.
Now, toward the end of your statement, you said in summary, and then there are three aims. The second is fostering the development of social work research. So is the program about educating, developing practitioners or researchers?
So it is both and, it is theory and practice. And one of the things that you will find is that the Council on Social Work Education really has 10 standards. And one of those standards, you really have to respond to social work research. And our program really is about the hands-on applied research in solving the urban issues, while at the same time, making sure that our students are equipped with the theoretical underpinnings that the profession requires. And so we look at both theory and practice, which is social work research. The experiential learning that our students will get in the field will be critically important in terms of undergirding their experiences. So whatever theoretical applications that they're learning in the classroom setting or lab settings, those things will be transformed in an applied way, because the MSW requires a minimum of 900 hours in supervised field experience. And so social work research and clinical practice come hand in hand under a theory to practice model.
How many years or decades is 900 hours?
Well, the social work, a master's of social work typically is about a 2-year process. But if a student enters our program with a BSW, they can enter as advanced status, and they would be able to complete the program within a year.
So UDC has already applied for accreditation.
That is correct.
When do you expect to get it?
So we will have a visit potentially in February for candidacy review. That means that the CSWE will provide feedback on our candidacy application. As early as fall of 24, we could have a potential site visit. And then after that site visit, we would have what's called a self-study report due. So if in fact the candidacy review process potentially in February goes well, we could get the green light to begin action steps towards advertising for positions, thinking about ways in which logistically how we want to set up the program. But clearly by fall 24, we are anticipating the site visit.
Are you enrolling students before then?
We will not be able to enroll students for that because we would not have had the site visit. And so, you know, it's almost the chicken and the egg or the horse and the carriage. One of the things that our program seriously contemplates, however, is an accelerated advanced generalist model. And so if there are students who are currently in our program based on our curriculum, there are a subset of courses at the junior or senior level that may count towards their MSW, which means that we're trying to build a seamless pathway. If individuals, once we start to recruit and admit students into our program, given the permission of CSWE, if they enter with the BSW, they will have advanced standing.
Which is the 1 year.
Correct.
For the master's.
Correct.
So what's the earliest, assuming green lights all the way, what's the earliest you'll be able to enroll for the master's?
Assuming green light is all the way, we would hope spring of 25, January of 25, because the site visit would be fall of 24.
Now, we put money in the budget, I think, for FY '24.
Correct.
What's that money going for?
So
Since it's not paying for scholarships.
given the fact that we will have a site visit in fall of 24, and given the fact that we will have a candidacy review in February of 24, we may get the green light in February of 24 to begin to hire faculty. So one of the things I think that you know, Chairman Mendelson, that is critically important is to have personnel and boots on the ground. If in February of 24, the candidacy review is positive and we get the green light, we can begin to advertise and recruit faculty and have faculty in place by fall 24, who would then be responsible for building the foundation of the program, making the connections with the community. Many of the recommendations and suggestions that you heard in the testimonies could be integrated into the curriculum. And so I think the advantage of the council promoting and supporting this program with the funding that is proposed in this bill bodes well for the university, particularly in advance of the site visit.
Well, it does strike me there might be a misalignment here, and that's not necessarily a bad thing. Other than that, I don't want you coming back saying you need more money. I believe we funded about 6 million a year.
Have to go back.
Is that right, Councilmember White?
Let me double check. I think it's 6 to 7 million over the financial plan
Okay, that
over
might
the 4
be-
years.
Yeah, about
So,
1.2 per year, I think.
okay, so I misspoke, about 1.2 million a year, maybe a little bit more. If you're using all of that for faculty, that leaves nothing for scholarships. And our intent is that this is for scholarships as well as what else is needed.
Absolutely. And so
So-
it would not be all used for faculty. I think one of the things that became very clear in the testimony is that tuition cost at many of the other institutions are extremely high. A graduate per credit hour at the University of the District of Columbia, so an MSW, for example, would be $513 per credit hour. If we get the green light in fall of 21 to move forward, if an individual student has a BSW coming into the program, they will have about 30 hours that they would need to complete for the MSW in that 1-year advanced degree program. And so that 30 credit hours would yield to about $15,390 over the course of that 30 credit hours. If the individual does not have advanced standing and they have to take the 51 credits, and if we get the green light to go, at $513 per credit hour, the individual would, over the course of 2 years, it would be $26,163. And so much of what we believe that has been appropriated in this bill would be for scholarships, very similar to what we've done with our teacher education preparation program.
But you have money now. You're not really hiring until next year. And then you are doing the scholarships in the fiscal year after that. We put money in now, so that's why I said there's some misalignment. All I care about is don't come back and ask for more money.
We hear you very loud and clear, Chairman Members.
I'm a little bit over my time. I do have some more questions. Let me turn to Councilmember Robert White.
Thank you, Chairman. So where I'll start will be a little redundant. I just want to make sure I understand the details as well. The funding would become available in October if things go according to plan. Site visits and hiring would start in the sort of early to mid parts of next year, February 24 and fall of 24. So I think that tracks with the appropriate timeline for getting the program going. Was it the site visit or the hiring of faculty that would happen in the fall of 24, Dr. Potter?
So the site visit would happen in the fall of 24. Our potential site visit would happen in the fall of 24. And after that, then if we got the green light, we could begin the process for hiring back.
Got it. Okay, so you're not going to get, the university will not get accredited if you don't have faculty. Is that right?
That is correct. That is one of the standards. You must have qualified faculty and personnel before you can even begin the degree program.
All right. Do you have a sense of, once the program is up and running, about how many students you could accommodate with scholarship per semester or per cohort?
I don't have that breakdown with me right now, but as we continue to build out the program plan, Councilman White, I would be able to get that to you and your team.
I appreciate it. And do you believe that the funding available is sufficient to attract the highest caliber of faculty?
Absolutely, absolutely. With our BSW program, we have high caliber faculty currently, and being able to bring on additional faculty for the MSW program, because our BSW program has been accredited for quite some time. And one of the things that I would highlight is that it's one of our top 5 undergraduate majors. So we have students who are ready to move into the MSW program. And so I have, without question, no reservations of us being able to hire highly qualified, highly competent faculty.
Excellent. One of the places that we are seeing high vacancy rates, as I mentioned in my opening statement, is with the school-based behavioral health program. And I've had a few people ask me if there would be any way UDC's program could create a partnership with DCPS or DC public charter schools to help build a workforce pipeline directly into this program, possibly by having field placements within schools. Do you have any reaction to that idea?
Absolutely. And I think it would be important to underscore that the University of the District of Columbia currently has a number of standing MOUs with DCPS. About a year ago, the council provided appropriations for our Grow Your Own teacher preparation program. And so one of the beautiful aspects about our social work program and our education program is that they're housed in the same division within the College of Arts and Sciences. So there are already collaborative, interdisciplinary, cross-disciplinary interactions that are happening with faculty. And I would see that in our current standing MOUs with DCPS, with OSSI, we would be able to build field placements into the DCPS opportunities.
Okay.
I don't see a problem with that at all.
Excellent. That's actually where I wanted to move next. There's UDC is doing a similar scholarship program with a teacher prep program, Grow Your Own. How do you know? I'm not sure if this is sort of in your purview. Do you know how that's working and whether there are any lessons learned from that program that we should apply to this scholarship program?
So yes, we do an annual report, and so by September I'll be working on a second annual report. And I think one of the things that we have learned is that the wraparound services and the supports and outreach to the students in that education pathway is critically important. And this is a suggestion that one of the testimonials provided, that social work is not simply an educational experience. And so part of the wraparound services and supports and what I would consider boot camps that we are utilizing to prepare our teacher preparation students for the praxis, the same types of activities and preparations would go into building the MSW scholarship support program. Because it's not just about the students getting the education and the field experience, but it's really about preparing them to sit for the board examination for a licensed clinical social work. So I think that there are a number of positive correlations.
Okay. Chairman, you asked a lot of the detailed questions I was going to ask, so those are all that I have. But Dr. Potter, you have really put an incredible amount of work into this program, into this bill, and trying to get this program off the ground. So I want to thank you for your work and for being with us today.
My pleasure.
Thank you, Chairman.
Thank you, Councilmember. Councilmember Nadeau, if you have any questions, you may not still be here. Councilmember Parker, I believe, has stepped away. So let me ask some more questions and I'll give you another chance, Councilmember White. How many students do you expect will take part in the master's program?
So I think one of the things that we're really working on right now, and based on our CSWE, and this is to Councilmember White's question earlier, we would probably be looking at a cohort of 15 to 20. We really need to make sure that we are in alignment with the faculty-student ratio that CSWE requires. We've not had our outbreak sessions with them to date, and so I would not be able to give you an exact number. But once we've had that outbreak meeting and the follow-up conversations about our candidacy review and the schedule, they will propose for us the number of students we would be able to admit per cohort. But we're thinking 15 to 20 per year.
And how many faculty do you anticipate will be required?
We will probably onboard 2 full-time teaching faculty, a director of field placement. CSWE requires at both program levels that you have a program director of field placement to really liaise with the community and the nonprofit agencies and the schools for those placements. And then I think we would have a professional staff person to ensure that that minimum 900 hours in field placement was being done. So about 4 full-time FTEs.
And these would all be new?
Yes, because they would be specific to the MSW program. We would not be able to duplicate what we are doing at the DSW level.
Saying 4 full-time suggests there might be some part-time?
It would really depend on the makeup of the cohort. I mean, if we have a number of advanced standing students who are admitted to the program, they're going to be taking upper division courses. If we have a number of students who are not credentialed at the DSW level, so potentially there could be some part-time adjuncting, but that remains to be seen.
Looking more specifically at the bill, the scholarship is limited to DC residents who are graduates of a DC public school. Is that too constricting?
It potentially could be, but if we are really focused on growing pathways and pipelines for DC residents, if we are being intentional about these individuals coming into the university and spending 2 years of service in the workforce, there are some direct correlations. And so I don't know that it is not too restrictive. I would hate to say that it's not too restrictive. I mean, we are a melting pot, but I think the language in the bill was intended to mirror what it is that we did with our teacher preparation program.
Which I take it then has a similar restriction.
Yes.
So there was a witness who testified that she had graduated with some degree, which was not social work, and she went into some profession, which was not social work. Now she's interested in social work. I'm going to assume she didn't graduate from a DC public school. She would be ineligible for the scholarship.
That is correct, based on the way the bill is written currently.
And if I wanted to give up my job and become a MSW, I would not be eligible because I didn't graduate from a DC public school.
Right, but if language is inserted that you are working at a DC agency or that you're working within DC, that provides a little bit more latitude and flexibility. Because you would be talking about a professional workforce in a graduate degree program.
Chairman?
Yes, sir.
We changed that in the drafting, so it is no longer restricted to graduates of DC schools. So we could, if you want to leave, we will support you.
I'm sort of trying to find the language.
Language now is that you have to be a resident of the district, be a graduate of a district public school, or be employed by a district government agency or healthcare provider organization.
Yes, which speaks to what I was just asking about. And what Dr. Potter just said would be helpful.
Right, so not a district resident and a graduate of a DC public school, a district resident or a graduate of DC public school or employed by a district government agency.
Okay. The scholarship would cover tuition, books, supplies, licensing fees, and a monthly stipend. Is it reasonable to include all those in the scholarship?
Absolutely. And I will say, Chairman Mendelson, having developed and worked with our deans on a number of pathways, whether that was IT or nursing, one of the things that we have found to be consistent for DC residents is that life gets in the way. And so transportation, food insecurity, childcare, all of those things get in the way. And so the direct pay stipend has benefited the continuity of many of those students who are enrolled in programs to show up because there's a level of support. And I think that as you heard from some of the testimonies, particularly 2 students who graduated from the University of the District of Columbia with their BSW, it's very difficult to keep up with rent. It's very difficult to figure out where the next meal is coming from. And so if they are graduates who are currently employed, it would seem to me that many of the students that we continue to serve who are first in their families or who are adult learners with background issues, that the stipends are critically important.
How much is a stipend typically?
So it just depends. I think with the ARPA funding that we received for our nursing students, we were providing stipends of direct pay of upwards of $1,000. But of course, those were limited term funds. And so based on the complete budget in this bill, we would need to identify books, cost of tuition, license preparation, and determine what would be an appropriate stipend.
For nurses with ARPA money, that was $1,000 per month?
No, $1,000 cap. And so it worked out largely because what IT was $1,000, nursing was $2,500 when I think about it at the community college and workforce development, because our nursing students had more challenges. They had uniforms, the transportation, the preparation. So we capped the nursing stipends at $2,500 with ARPA and our IT students at $1,000. And so if I'm thinking about our MSW program, and once it is green lighted, a cost of, I just don't know what that stipend would be. So
Okay.
I would need to have my subject matter experts internally to think about what would be appropriate for graduate student stipends.
I have two more questions. The bill provides that to be eligible for the scholarship in exchange for accepting the financial assistance, that the program participant shall commit to working at a education agency in the district or a government agency in the district or a healthcare provider organization, presumably in the district. How do you enforce that? You probably don't. How do we enforce it?
Well, I mean, there are a range of ways we can do that. Enforcement is always a slippery slope. But as we've done with our Grow Your Own Education program, we have students to sign contracts of commitment. And basically, you really have to take an individual at his or her word. Unless there are sanctions of repayment, you know, you really have to go with the honor code. But it's my hope that given the fact that these individuals would be entering into a practice program that is grounded in ethical responsibility, and they would fully understand what the formation is for the profession, that then that ethical responsibility in their own personal space and personal lives would hold them true to committing to the 2-year work experience in the district.
So for nurses, teachers, there's a similar requirement
For our teacher preparation program.
for teacher.
Yes,
And do you have in the contract a clawback of the financial assistance?
we don't. But I mean, you know, those are things that we would need to explore with our general counsel. We just don't know. And I can just speak from previous experience. I mean, the National Science Foundation with NOICE and all of the support that we've provided over the years, you know, they want you to track the students. They want the students to do various things within school districts. If someone decides to pick up and move because life gets in the way and they fall in love and someone lives in Tampa and their career takes them there, I just don't know how you can enforce that.
So clawback's possible. Haven't done it.
Correct.
Not sure it's a good idea. Not sure it's the best idea.
Correct.
A last question. I know that it's important to UDC's accreditation that UDC is independent of the political folks, that we, the council and the mayor, need to be mindful that we're not telling you what to do and infringing on that independence that jeopardizes your accreditation.
That is correct.
Am I saying that correctly?
That is correct.
Okay, does this bill in any way implicate that issue?
I think the only concern, and we've raised this in our prior discussions, is that the bill supports the program, and I think that bodes well. I think anywhere where language says the university is required to create an MSW program would be problematic for CSWE and for Middle States. But that would be the only concern.
Okay, let me see if Councilmember White has any more questions.
I don't, Chairman. Thank you. And again, thanks to Dr. Potter.
All right, I don't think I have any questions, any more questions. We will follow up with you or you follow up with us.
Absolutely.
Please, because we're looking to mark this up in the fall.
Okay.
Possibly September 19th. That's not a promise. I'm looking at Councilmember White. That's a possibility.
Okay.
Thank you very much for your testimony. I do want to know we've been joined by Councilmember Fruman, who says he doesn't have questions unless you want to say something. Okay. So thank you.
Yes.
I'm going to wrap up this hearing. We have another hearing that will follow immediately, which concerns the nominations to the UDC Board of Trustees. This is UDC Wednesday here at the council. This has been a hearing on Bill 25-55, Pathways to Behavioral Health Degrees Act of 2023. The record in this matter will close at 5 p.m. on Wednesday, July 26, 2023. Time is 11:13 in the morning, and this hearing is adjourned.